Good morning, good evening, whichever part of the world you are. This is Dr. Lenny Costa coming to you from Goa, India. And yes, today I'm going to be speaking to you on IV therapies in aging disorders. Yes, so what is my credentials to stand here before you and speak about it? I'm a geriatric physician by profession. I've been using this IV therapies over the last 20 years and have treated over 25,000 plus patients, out of which about 80% have been aging population, which has benefited from this IV therapies, where the chronic degenerative conditions have always been taken care of. So with this few words of introduction, let me get started and share my presentation with you. There we are. IV therapies in aging disorders. So for aging disorders, what are the IV therapies that we use? I normally use L-carnitine, N-acetylcysteine, glutathione, and alpha-lipoic acid. There are many more, but because of constraints of time, I thought I will give you the four most important ones which give you instant results in your aging population, especially those with whom you see symptoms where modern medicine sometimes cannot get rid of the symptoms and cannot elevate the sufferings of these patients. So here we go. What is L-carnitine? L-carnitine is a trimethylated amino acid, like cofactor for the transport of free long-chain fatty acids into mitochondrial matrix, where beta oxidation occurs for cellular production. Now, what does this really mean? It is a cofactor that transports free long fatty acids. So free fatty acids that are present in your blood get transported within the cell into the mitochondria for energy. So what does L-carnitine do? It enhances the energy production of the cells. While doing this, what happens? Your cell gets a kind of additional boost. A dying cell suddenly gets fresh energy. Why does a cell die? Because there is lack of energy, or it is working at a reduced energy load. It can't produce the energy that it needs for its regular work. And that's when it starts dying. So when you give it this extra workload, this extra boost of energy, you are helping this cell to survive. Originally, this was isolated from meat in 1905. Only it was 50 years later that its role in metabolism was discovered. And it's only in 1973 where carnitine deficient humans were seen. So when we look at this particular molecule or a nutrient, this is basically a nutrient. L-carnitine is nothing but the nutrient. It does not have, it's not a chemical, it's occurring naturally. And therefore today you get it made by a lot of pharma companies available to you to be used regularly for your patients. This has been used for heart health mainly, but one of the other nutrients that it works very similarly with is coenzyme Q10. So when you look at heart nutrients and degenerative conditions of the heart, of course, coenzyme Q10 comes first, L-carnitine second, but L-carnitine can be given IV and the efficacy is faster. Coenzyme Q10 is a fat-soluble nutrient and therefore needs to be given orally. You hardly have any injectables available of coenzyme Q10. Now, vegetarians are likely to be deficient in it, obviously because the source is red meat. Vegetarians, vegans, they generally will be deficient in it. And we need to keep this in mind when we are treating vegans and vegetarians, and therefore this becomes our #1 IV therapy when we are looking at vegetarians, specifically if you're looking mitochondriopathies or even muscle dystrophies or just muscle fatigue that you see in elderly patients or aging populations or even much younger populations who are today aging prematurely. So you don't need to look very far. The moment you know that the person is vegetarian, you know that he's not getting red meat, you know that there are nutrients missing, this would be one of your answers to get rid of some of his symptoms. Orally, it is also used for body sculpting and other carnitine deficiencies, but for body sculpting, it's being used in Southeast Asia very, very effectively you can stop, putting on weight. You kind of get your body shaped in a particular manner if you take anywhere between 2 to 3 grams orally every day. I have not used it. I use it more effectively because of my kind of practice that I have in IV manner. Like coenzyme Q10, carnitine deficiency is not a factor in healthy, well-nourished population consuming adequate animal protein. So what are the conditions that affect it? The aging, genetic defects, cofactor deficiencies like B6, magnesium, folic acid, iron, vitamin C. Liver disease or kidney disease also affects it. Anticonvulsant drugs and other dietary considerations can cause carnitine deficiency. So it is not only not eating red meat, it could be any one of these conditions that can also cause carnitine deficiencies. And sometimes we need to look at this when we have patients coming with symptoms that are very, very similar, where you see that the muscles or the body cells are energy starved, and therefore there's a lot of fatigue, there's a lot of cachexia and other symptoms that you can't normally get rid of with too many medications. So it's found in the muscle, found in meat, it's found in the muscle of sheep, lamb, cattle, and of course pig. Very low in cereals, fruits, and vegetables, and hence very low in vegetarians. Like I said, it is responsible for the beta oxidation of fatty acids in the mitochondria. 60% of the heart metabolism, energy metabolism, is of fatty acids, and therefore L-carnitine plays a huge role in an energy-starved heart. And where would you give this? So one of the first conditions for an aging heart is diastolic dysfunction. You see at the age of 35, 40 when you do the first echos in certain patients. When you see diastolic dysfunction, this is an aging condition. You need to give L-carnitine to stop the progress of this, because a diastolic dysfunction is an energy-starved heart. Removal of lactic acid and other toxic metabolites from the blood. It does this as well. It is good for ammonia detoxification and hence used in all renal dysfunction cases or early renal failure, chronic renal failure. If you find that the patient's renal functions are slowly deteriorating, L-carnitine with the one that I want to talk to you about, N-acetylcysteine, together can delay this process